This is Dr. Manasi Kulkarni-Khasnis, and we are in conversation with Dr. Ashish Dhande, who is MD Pathology and Lab Director and Consultant Pathologist at Dhande Diagnostic Labs Private Limited. We are discussing with him who is a pathologist, what are the different detection methods for lung cancer under our Varsity Lung Empower Drive Cancer Awareness Program. Welcome, Dr. Ashish.
Thank you.
So, could you share a bit about your personal journey? What inspired you to become a pathologist?
I am extremely fortunate that I was born in a medical family. My dad, Dr. Dhande, is a well-known pathologist in Pune, working for the last 36 years in the field of pathology. And he is my biggest inspiration. His passion and dedication towards his work, building patient relationships, and he had a humble background, but since start only he was doing all the work right from patient collection, home visits, and we used to visit the lab. He used to do new reagent methodologies, teaching of staff, as well as typing using a typewriter.
Great. So to our listeners and even for me, who is a pathologist?
Okay. So pathos is disease.
Okay.
So a person who diagnoses diseases is known as a pathologist.
Okay.
He does so by examining various tissues or blood, and after examination and various tests and using technologies, he differentiates the diseases into cancer, non-cancerous, infectious diseases, autoimmune, molecular, or genetic diseases.
Okay, so a pathologist is basically a trained personnel specialized in differentiating between healthy and unhealthy samples.
Right.
Samples coming from healthy and unhealthy subjects.
Yes. And he gives a definitive diagnosis which is very vital for other doctors to have a good patient outcome as they can plan the treatment accordingly.
So a pathologist decides what should be the basically what will be the future of the patient.
So.
Okay. So since Dr. Ashish, this is our Varsity Lung Empower Drive, we are seeing 1st of August as World Lung Cancer Day, and in view of that we are celebrating this entire month to make people aware of lung cancer. So can you tell our listeners what is lung cancer and how, what are the challenges in detecting it?
So the biggest challenge in detecting lung cancer is that most of the lung cancer patients are asymptomatic, or even if they have symptoms like persistent coughs, blood in sputum, chest pain, they are attributed to other causes like respiratory infections, COPDs, emphysema, like that. So it is very difficult to catch them at early stage. Second is inadequate screening method. So apart from low dose CT scans, there are very few newer techniques, but that is the biggest challenge in detecting of lung cancer. And thirdly, lung cancer itself is very aggressive, especially the small cell lung cancers. Even if they are detected early, they can spread immediately to other organs.
So we often hear that early detection impacts the patient outcome, and for a pathologist, detecting something very early on is your mission.
Right.
But how is it in terms of lung cancer?
Okay. So impact of early detection of lung cancer is very crucial in high risk cases who are smokers or who have exposure to asbestos or radon gas, or they are exposed to second-hand smoke, or having a family history of lung cancer. So early detection enables us to detect the 5-year survival rate, which is about 60% if it is detected earlier, and less than 10% if it is detected in the advanced stage. Also, it decreases the mortality, and we can also see that early detection helps to the patient to choose from different options of treatment. So if it is an early stage, we can provide him with targeted therapies or even surgery, which can itself become a curative treatment.
Correct.
As against in advanced stages, we have to expose the patient to high dose chemotherapy, radiation, and other treatments which have got side effects as well.
Right. So, but are there any challenges in early detection right now? How are we detecting lung cancer today?
Okay. So, from a pathologist perspective, lung cancer can be diagnosed based on histopathology using lung biopsies or bronchial washings. And then cytopathology, sputum cytology, pleural fluid can be seen under microscope for presence of malignant cells. and after having the tissue, we can differentiate the types of tumors, and if it is difficult to differentiate the type of tumor, we can use immunohistochemistry. So that can help not only in diagnosing the disease. Lung cancer is also notorious to having metastasis, so we can know the primary tumor as well as some markers which can be help in predicting the course of the treatment.
That is okay. And is it also suggestive of some prognostic implications?
Yes. So in lung cancer, we can do PDL1 marker, which is a biomarker, which can give if it is effective for immunotherapy. So that is one thing. Other molecular tests are coming in a big way for diagnosing lung cancer. We can use next generation sequencing, RT-PCR. So next generation sequencing can sequence a lot of genetic mutations and genomes, even exomes and targeted gene sets, so that we can help in lung cancer targeted therapy. It can diagnose ALK, EGFR, ROS2 and other markers.
Right.
Also newer techniques like artificial intelligence, digital imaging, FISH, and flow cytometry can also be used.
Okay. So right now, all of these techniques, what you are saying, are currently used, like bronchial washings, then sputum cytology, biopsies.
Yes.
All of these are basically techniques that are used to diagnose after the patient is shown up to the doctor or the oncologist,
Right.
and when he is hugely symptomatic.
Right.
And that means we are detecting cancer at fairly late stages.
Six stages. Exactly.
Right. And so early stages detection, what are the premises over there in India?
So gold standard is using low dose CT scans. So it is recommended that every individual from 50 to 80 years of age who is an ex-smoker has to go low dose CT screening, and if it is positive, then we can also go for liquid biopsies. So liquid biopsy is a non-invasive method in which using blood you can detect the circulating tumor cells or circulating tumor DNAs, and we can perform molecular tests on them, and it can be used for early detection as well as monitoring and response of treatment.
Got it. So the summary of this conversation, listeners, is that a pathologist has a very crucial role to play in a patient's life cycle when he experiences symptoms to he gets the treatment. And a pathologist plays a very important role in differentiating between diseased and non-diseased state, and basically guides the treating doctor to take actions in the correct form. Talking about lung cancer is a very prevalent disease in globe and India, and early detection makes it more manageable. However, there are very limited early detection techniques that are there which have promise in detecting cancer at stages less than 3 and 4. With this is Dr. Manasi-Khasnis signing off on the first part of our conversation with Dr. Ashish Dhande. Stay connected for part 2.